Hi, my name is Johanna Bendell, and I'm the Director of GI Oncology Clinical Trials at the Sarah Cannon Research Institute. I am so excited to be here today to talk about the future of treatment for patients with colorectal cancer. For the last, about 10 or 15 years, we've had the same agents that we've been using to treat patients with metastatic colorectal cancer. We've managed to improve the survival of patients with metastatic colorectal cancer from a year to probably over 2 years now, and we're so happy about that. But we've needed to come up with some new agents to help patients battle cancer and find out better ways to use the agents we already have. I'm so excited to talk about data that's probably going to be shown at this year's American Society of Clinical Oncology meetings that is going to update us and tell us about new agents that are available for the treatment of patients with metastatic colorectal cancer to even improve their survival further. There have been 3 recent trials that have been publicized that tell us that attacking tumor blood vessels in the treatment of metastatic colorectal cancer will help continue to improve patient survival. The first trial that you might hear about is a trial called the Vellore Trial. This trial used a drug called aflibercept, which targets the blood vessel growth of cancers in a little bit of a different way than bevacizumab does. We saw in a randomized clinical trial that treating patients with aflibercept plus chemotherapy versus aflibercept alone in patients who had already had progressive disease on their first chemotherapy treatment for metastatic colorectal cancer improved their survival. This was very exciting because this was the first addition of a new agent in the treatment of metastatic colorectal cancer that we've seen in a few years. The next trial that we heard data on was a trial called the Colorectal Trial. This is an agent called Regorafenib. What Regorafenib is a pill that also attacks blood vessel growth to tumors in a different way than bevacizumab and in a different way than aflibercept. And more importantly, it's in a pill form. In this trial, patients who had what we call refractory colorectal cancer, or patients who had seen all of the possible standard treatments for colorectal cancer, were treated with Regorafenib versus a placebo. And what we saw from the results of this trial was that taking the Regorafenib pill actually improved survival of patients rather than just taking the placebo pill. And the third trial we have only seen a press release on, but we hopefully will see that data presented at this upcoming meeting, is looking at continuing bevacizumab throughout 2 lines of treatment for the patients with metastatic colorectal cancer. What is lines of treatment? What we mean is that we know that when you add bevacizumab to chemotherapy for the first chemotherapy patients see when they're diagnosed with metastatic colorectal cancer, we know this improves patient outcomes. We also know that once patients have progressed on first-line chemotherapy or their first chemotherapy regimen, if we add bevacizumab into the treatment of chemotherapy in what we call the second-line setting, it improves survival. What we didn't know is, can we just continue bevacizumab in their first chemotherapy and then into the second chemotherapy, and does that help people live longer? And what this press release from this trial has shown us, or told us, is that indeed we do continue to improve survival, continuing bevacizumab with different chemotherapy regimens throughout what we call multiple lines of therapy. These trials are showing us the first data in a few years that we can improve survival for patients with metastatic colorectal cancer. There is so much hope out there, and there continues to be hope out there. We're also hoping to see some more trials, which we don't know if they'll be presented at this year's meeting, but we're suspicious that they may, that will also show us some new therapies and new pathways that we're attacking for patients with colorectal cancer. So the good news is that there is so much coming in the future, and I think that we're on the wave of new data that's going to give us more hope and more promise for improving the lives of patients with metastatic colorectal cancer.